Welcome back to Module 1 of your Home Health Aide training. In our last segment, we discussed what is home health care and its core goals. Today, we're taking the next crucial step. Understanding who receives home care. This knowledge isn't just about identifying categories. It's about recognizing the diverse lives, unique challenges, and specific needs of the individuals you'll be directly supporting. Knowing this deeply will enable you to provide truly empathetic, effective, and person-centered care. Let's explore the various groups who benefit from home health services and what that means for your daily work. Home care is a flexible service, expertly designed to meet a wide range of individual and family needs. As an HHA, you'll find yourself making a significant difference for many different types of people. Let's look at some of the most common groups you'll be assisting, with a focus on what this means for your approach. To begin with, support is often provided to older adults. As people age, they may experience reduced mobility, the onset of chronic conditions like arthritis or diabetes, or even cognitive changes such as early-stage dementia. For you, this means understanding their personal history and routines are key. For instance, you might assist Mr. Johnson, an 85-year-old who, due to severe arthritis, struggles with fastening buttons on his shirt. Your role here isn't just to dress him, but perhaps to help him choose clothes with larger buttons or zippers, or to patiently guide his hands to maintain his fine motor skills, allowing him to participate as much as possible, preserving his sense of self and dignity. They remain in their familiar surroundings, maintaining independence. People with disabilities include individuals of all ages living with physical, intellectual, or developmental disabilities, often from birth or due to an accident. Your role as an HHA will involve adapting your care to their unique abilities and challenges. Imagine supporting Sarah, a young adult who uses a wheelchair and needs assistance with transferring to her bed, or with preparing meals using adaptive kitchen tools. You should always involve them in decisions about their care, respecting their agency. You might learn her preferred transfer method or discover her favorite healthy snacks, empowering her to direct her own daily living and participate fully in her home life. Home care is also offered to children with special needs. These children may require complex medical care, intensive therapy support, or specialized assistance with daily routines due to chronic illnesses, developmental delays, or various disabilities. This support is often a critical lifeline for their families. For example, you might be assisting young Leo, a child with severe cerebral palsy, who needs help with feeding, positioning, and perhaps even understanding his nonverbal cues. Your actionable contribution here is to meticulously follow his care plan, communicate closely with his parents and therapists, and create a calm, stimulating environment. This direct support allows his parents much-needed respite, knowing their child is in highly capable and attentive hands. Another significant group includes patients recovering from surgery or a major illness, such as a heart attack or stroke. After a hospital stay, many need temporary, focused support to regain their strength, manage pain, and prevent complications at home, often preventing readmission to the hospital. For instance, you might assist Mrs. Chun, who's just returned home after hip surgery. Your actionable care includes helping her safely transfer from bed to chair using proper body mechanics, reminding her exactly when to take her prescribed pain medication, observing her incision for any signs of infection, like redness or swelling, and diligently reporting any changes to your supervisor. Your observational skills are critical here. Finally, we provide profoundly compassionate care for terminally ill individuals. This often falls under hospice care, where the focus shifts entirely from curing an illness to providing comfort, effective pain and symptom management, and profound emotional and spiritual support during their final stages of life. Your presence can be incredibly comforting and meaningful. Picture yourself providing gentle personal care to a patient like Mr. Lee, adjusting his pillows for ultimate comfort, and listening patiently if he wishes to share his thoughts. Your key role here is to prioritize their comfort above all else, and offer a calm, supportive presence for both the patient and their grieving family, allowing them to spend their last days with peace and dignity in their home. For all these diverse individuals, the services you provide are carefully tailored to their specific needs. These aren't just tasks, they're real opportunities to provide care that matters. Let's look at some of the key ways you'll make a difference. This includes crucial personal care like assisting with bathing, dressing, grooming, and toileting. This requires immense respect for privacy, maintaining dignity, and using proper techniques to ensure both patient safety and comfort. For example, knowing how to safely transfer a patient to a shower chair or how to help someone dress while minimizing discomfort. While primarily performed by registered nurses, home care also includes skilled nursing services, such as wound care or monitoring vital signs. Your role here is critical observation and reporting. You'll be the eyes and ears for the nurse, noting any changes in a patient's condition or response to medication, and promptly communicating those observations. Many patients also receive therapy services like physical, occupational, or speech therapy in their homes. Your job is to understand and reinforce the therapist's instructions, assisting patients with prescribed exercises between therapy sessions, and encouraging their progress. For instance, helping a patient perform their prescribed arm stretches daily to improve mobility. And importantly, home care provides much-needed respite for family caregivers. Families often carry an incredible emotional and physical burden. Your presence allows them to rest, run errands, attend doctor's appointments for themselves, or simply have a quiet moment, knowing their loved one is in capable, compassionate hands. This support is vital to prevent caregiver burnout. To recap this segment, you now have a deeper understanding of who receives home care. A diverse population including older adults, individuals with disabilities, children with special needs, patients recovering from surgery, and those facing terminal illness. We've also highlighted the actionable types of services you as a home health aide will provide, from essential personal care and assisting with therapies, to being the observant link to skilled nursing and offering invaluable respite for families. Recognizing these varied needs and approaching each situation with informed compassion is the foundation of becoming an exceptional home health aide. In our next lesson, we will begin to explore the core responsibilities and ethical considerations that will guide your daily practice. Thank you for your dedication to this vital and rewarding profession. We look forward to continuing your training.